Hi there, Wellness Wednesday listeners. We wanted to share some exciting news with you. We just recently launched our brand new updated website. Thank you so much to our media director, Mr. Mike Jones, for tackling that. But it's so nice. You got to go to our website, 3wmedical.org. It's the same URL. It's just this fresh new look. So easy to navigate. There's so many new pages on there that we've added about ourselves. And we really, really want to invite you to take a look at it. Give us some feedback. Do you like it? Do you hate it? Was it easy to navigate? Was it difficult to navigate? Any feedback would be wonderful. Thank you so much. Check out our new website once again, 3wmedical.org.
Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Alejandra, Content Marketing Specialist at 3W Medical for Women and the host of today's podcast. Hello, 3W friends. Welcome back to another episode with Wellness Wednesday here with 3W. My name is Alejandra, and I'm here with a surprise guest, and I'm going to have him introduce himself, but he has been on several of our podcasts before, and we are celebrating, or more just bringing awareness to Men's Health Week, which you'd think, why are we talking about Men's Health Week here at a women's clinic? Well, we're going to fill you in on why, but we'll introduce our surprise guest.
Sure. Hi, everyone. My name is Hiep Nguyen. I'm a physician assistant, previously a volunteer, actually, at 3W Medical for Women. Recently, I've moved away to start my first job, my first career as a physician assistant out here in the Tri-Cities. I am currently working at the Miramar Center. It's with the Yakima Valley Farm Workers Clinic, a community health center that focuses on underserved and low-income families and patients. And it's been quite a fun journey so far. So it's good to be back and recording a podcast. And I know that I'm doing this from far away.
Yes. For those who don't
traditional.
Yes, for those who don't know, we're actually doing this podcast through phone, believe it or not. So it's awesome that Hiep is here through the phone to be able to share with us a little bit about Men's Health Week. And thank you so much, Hiep, for taking some of your time to
yeah, absolutely.
to share this topic.
I hope you don't feel too lonely in that.
It's definitely a little different, but it's great what technology can do. So
absolutely.
But yes, so just as we said at the beginning, we're bringing awareness to Men's Health Week, which is this week, June 14th through 20th. And we're just going to be diving into a little bit of key points as to why we observe Men's Health Week, what are some health focuses for men, but most of all, one of the services that we provide here is STI testing, not only for women, but for men as well. So, yes, highlighting a little
absolutely.
bit with Hiep, we'll be highlighting our STI testing, but we're going to first dive into some just general health questions, right? So, Hiep, why do we observe Men's Health Week?
Yeah, it's a good question. I mean, everything has like a week in the calendar, right?
Right.
We celebrate Men's Health Week mainly because we want to bring awareness. I think it's a good idea, even though there's like days or weeks for everything now.
Sure.
I think it's always good to have that awareness come about.
Mm-hmm.
And with it being June being like the Father's Day month.
Yes.
So it's good to kind of highlight, hey, men need health care too. They need, medical attention as much as women do, as much as like kids do, as much as older patients do.
Right.
And, it's the whole idea is just like, hey, it's okay to go see a doctor, and hey, it's okay to worry about what your health is like currently, even if
Sure.
you don't think there is anything going on, right? So
Right.
there's a lot of barriers into that, and I can go into it a little bit more, but
Mm-hmm.
it's kind of like the main idea of having like an awareness week for men is just to bring awareness to, most importantly, preventative health problems.
Sure.
One of the things that I have patients do is, hey, you don't have to come to see me every month or every 6 months. Come see me every year if you think you're healthy, and I
Mm-hmm.
can validate that you are. Just confirm that. And if anything comes up, we can always take a step
Mm-hmm.
before it's too late. So that's kind of the idea of preventative health. What we do is we look for long-term effects or health problems, especially those that runs in the family,
Sure.
kind of like diabetes, heart disease, mental health as well, something that is a big stigma for men.
Mm-hmm.
But I'm here to just say, hey, it's okay to get help. It's okay to
To go see a
see
doctor.
a doctor for anything. Yeah, exactly. Like I'm waiting for like my insurance to kick in to actually set an appointment to go
Oh,
see my
nice.
general health and where that's at. So yeah, like I recommend it to everyone, not just like men, but everyone as well, but specific for men. And I can list a few more things
Sure.
into
Sure.
why, we're focusing on men this week.
Mm-hmm.
But do you have any questions before I go into it?
Definitely. Well, one of my first questions is, why is it so difficult for some men to go to the doctor? Because
Yeah.
I know for sure some men in my family don't really think it's that necessary to go to the doctor.
I mean, you're not wrong. I rarely go to the doctor.
Really?
And nowadays, as a provider myself, I'm like, man, why didn't I go more often?
Wow.
And, honestly, there's a lot of barriers. And if I focus more on like the more socially discussed or more talked about ones, it's like, hey, if I'm feeling well, what's the point going to the doctor for? You know what I
Wow.
mean? Like, I don't feel sick. I don't feel like I need to go see a doctor. It's going to cost me money if I do that.
Sure.
And for them to say like, hey, you're doing well, a lot of times like, hey, if I'm feeling well, I don't need to see the doctor. And then other times when like there's something going on or like, what is going on with my body?
Right.
I blame the internet that they kind of like for us men. I can't speak for everyone, but at least for me, before I even go to the doctors, I go to Dr. Google.
Test
Dr.
out
Google's
and
the
see what
number
you
one
have.
doctor out there.
Oh,
Just
wow.
kidding. But like access to information makes it a lot easier to like figure out what your body has.
Sure.
And a lot of times that's one of the things that limit patients from going into the doctors, getting a confirmation, because the internet tells you what you have. I'm not saying every man does that or every person does that, but I mean, I do that sometimes too, just for a little bit of reassurance as well.
Sure.
But
Sure.
I think yeah. So like for me, if you ask me, why don't you go to the doctor often? My main reason would be, I don't feel sick. I don't feel like I need to see a doctor. So I think that's one of the reasons why men, especially, don't go see the doctor very often. And, if you compare that to women, like women, they have their menstrual cycles. They have a lot of concerns about their body,
Sure.
especially around that area in women's health.
Yeah.
And we recommend, like pap smears and stuff like that. So there's things that we screen for early on for women. So I think, this is my opinion, I think they go to the doctor, women go to the doctors a little bit more often because they have screenings to do, some preventative health medicine to do, and then they have menstrual cycles that affects their body and they want to understand it more. And men, they don't go through that.
Right. Right. It's a little simpler.
It's a little, well, I wouldn't say simpler, but I say they have less to be concerned about.
Okay.
Hopefully I don't get too much trouble for saying that, but but yeah, I think because we don't experience something on a monthly basis,
Sure.
it's harder for us to like, hey, let's go see a doctor to see if my body's okay.
Right.
I hope that makes sense.
Yeah. Well, it just makes me think of like, if somebody gets injured, right, and they dislocate
Mm-hmm.
something, or, they, feel pretty bad. And they're like, oh, you know what? It's, usually the men in my family that are like, it's fine. I don't need to worry about it. Or it just kind of adjusts or heals itself without even going and getting an x-ray, So just kind of looking at the perspective of a man versus a woman, and the reactions even of like, oh my gosh, I got hurt or I sprained something. I need to go to the emergency room. You just kind of see the levels of need for care or desire for care, as far as our health. Mm-hmm. But it's true. I guess it's just looking at it from a different scope or a different perspective, which I think is super great that you're here talking about it, because you yourself are, saying, oh, I go to Google first,
Yeah.
But with that,
I just did that today, honestly. So, I think something else that doesn't really get talked about too, and people can correct me if I'm wrong, but there's a little bit of ego that comes into this as well. It's like we don't, as men, we don't want to look weak. We don't want to seem like, we want to be in control of our bodies. We want to be able to look strong to other people, right? I mean, I'm like that too. I want to look healthy. I want to look strong for those around me. I have I have nephews and nieces at home that, I'm trying to be a role model for. So like, if I'm sick, it'd be hard to like take care of them.
Sure.
But at the same time, I can't take care of them if I don't take care of myself.
True. Which I feel is a huge point for everybody. If you don't take care of yourself, you can't take care of other people around you.
Yeah.
So that's a very good point.
Absolutely.
Well, now that you've shared, go ahead. Sorry. I keep interrupting.
That's okay. I love the delay in our
conversation.
Yeah. I hope everyone enjoys that as well. But what I wanted to say is like outside of all those kind of like, I'm not sick, I feel fine, and the internet kind of helps me with everything. Outside of that, there are other like real issues why men don't go see the doctor. One is access to healthcare, right? Like insurance. That's a huge one. Where I'm at right now, there's a huge population without insurance.
Wow.
And if they need to see a provider or a doctor, they have to pay out of pocket.
Mm-hmm.
But there are programs out there that provide discounts or even assistance to getting insurance. So that's kind of like one of the reasons why not a lot of people, not just men, but people don't go seek healthcare.
Mm-hmm.
And even let's just say, even if they do have insurance and they have access to healthcare, sometimes we still don't go see doctors or providers because of the quality of these doctors, right? Like, with healthcare systems nowadays, expecting us to see patients like every 15 minutes is really hard to have that personal time.
Sure.
And to like really understand what your health is. So access and quality of healthcare is important too. And that's something that, plays a factor into, everything
wanting
that we
to
just
go.
mentioned about how men wants to go to the doctors or not. So I have a lot of stories. I mean, I've already been patient for the last month or so. And there's a lot of stories about that.
Yeah, no, that's a really good point. And hopefully that becomes more accessible for people that don't have access to insurance or ability to have insurance. Just as you said, in the area that you are with the care and the patients that come in, their needs are unique and special, and just like everyone's, of course. So that's really good. A really good point. Now that you've shared with us kind of the overview of Men's Health Week and some of the barriers that maybe can happen, what are some of the health points, health focuses that you would say are essential for men as they, go about their lives, probably thinking they're fine, probably thinking they don't need to go to the doctor, but what are some things that they should be aware of?
Yeah, and that's a really good question, right? It kind of becomes the like, I feel fine kind of mentality. But there are things out there that are nicknamed the silent killer. That's because they don't like quote unquote kill you right at this moment, but they are slowly killing you down the road. And the more it compounds, the worse it gets in the future. But those kind of complications, like medical problems, are the typical ones that you hear a lot about, right? It's diabetes. It's one of them. Heart disease is another. And the plug that I want to make, especially for men, is mental health.
Oh, that's a good one.
And then,
it's important.
Yeah. Right. Not only men go get therapy, and like there's always a stigma, like I mentioned earlier,
right,
into that. But I see a therapist because there are times where I'm stressed and I don't have, the appropriate resources to help me kind of reduce that stress. So I do really advocate for mental health, not only for like women or kids or anybody with actual diagnosed illnesses to see a therapist, but like if you're 30 years old like I am and are a young professional, you're always hard at work, you're going to have, some days where you need to talk it out and share your stress so you don't have to bottle it in.
Yeah.
But, But anyways, I'll get into the details of that. I don't want to like ramble because I'm so passionate about mental health.
Yes. No, it actually sparks a memory. I think it was back in January. We came out with we featured an article about therapy and how it's very, like you say, very, I don't know, if I don't have a problem, I shouldn't go to therapy, but it just kind of sparks that awareness of like, not only do we need to take care of our physical health, but also our mental health, all the aspects of our life that entail for us to live a healthy life and thrive well. Yeah, that's not very much talked about. So I appreciate you brought that up too. Yeah. But
so like to give you an example, when I was still in school, this is probably exactly a year ago. About this time, I did a rotation down in California. And during this time, I was on my own. I was doing a rotation that I did not like. And I couldn't go outside because in California during that time, there was like really bad forest fires and wildfires.
Oh, yes.
So like I was stuck inside the entire time. So it was hard, like compounding me being stressed from my rotation, not being able to go outside to help with that stress. And on top of that, like just being physically alone was really tough. And there was a day that I was like, I'm not going into work today because I just need that mental day. And, I have good friends I can talk to, and they're kind of my therapist in a way.
Aww.
And, mental health, has been seen as like a sign of weakness a lot. I thought about that before I even attempted to use therapy, but like I knew I needed it. So I just went and do it. And it was actually really helpful. So for all the guys out there, there's nothing wrong with seeing a therapist. Do it.
Yes.
You need to.
Yes.
You don't trust anyone you don't trust anyone with your issues right now.
Right.
Have someone that has like complete confidentiality to just talk to you, help you like think through things. Like there's nothing wrong with that.
No, it's so true. It's so true. And I myself, I'm also, going to therapy too. And it's super helpful. It just kind of gives you a little bit clearer vision and just helps you improve your life and make you realize you're really not that crazy. You just have a lot on your plate. It's just like there's so many different aspects. And so, but yes, that's a great, great point.
Yeah, and it's a great way for you to like discover who you are as a person. And the reason why I said that is because I sit right behind our mental health like specialist at work.
Oh, really?
And we talk a lot to each other, mainly about our patients, but at the same time, she is able to kind of pick up on my mannerism and my thought process. It's like, you tend to overthink a lot, don't you? I was like, I do.
She's catching you.
Yeah, a little bit. And I mean, it's helpful, right? For me, knowing now that I'm aware of what I do unconsciously, subconsciously, I'm able to change that and kind of modify it to let it best help me rather than prevent me from doing what I need to do or being who I want to be. You know what I mean?
Sure. No, that's so true.
Yeah.
kind of tying into, well, these health focuses that are super important, like you mentioned, diabetes, heart disease, mental health, diving in more, because we are talking about men's health through the 3W perspective. And I think it's so cool that Hiep, having been here as a volunteer for a few months with us, looked at the needs of our patients, also looking at the perspective that, or the service that we offer to the men in our community, which is STI testing. So tell us a little bit about that.
Yeah, I mean, for young men who are sexually active, there's always a risk for sexually transmitted infections. And like for every woman that I saw at that clinic that I recommend, getting STI testing, every time there's a new partner, I would recommend the same for every male patient to get tested if they had a new partner. And, the earlier you get tested, the earlier we can take an action on it if anything comes back concerning. But at the same time, if it's negative, it's a reassurance, right? That you don't have these kind of infections to worry about. And, at 3W, it's pretty cheap compared to most places.
Right.
And like I mentioned earlier about how quality of care and being 15 minutes appointment, at 3W, you get a whole hour to talk with a medical professional, about what STIs are, what the expectations of these tests are, and to further educate guys about these things. That's one of the things that Men's Health Week is doing, is to educate men and women as well on the health problems that may not be quite life-threatening in the moment, but has detrimental or even long-lasting effects.
Sure. Yeah, no, that's so true.
Even if you don't have symptoms or concern about anything, it's always good to be educated about your health at this moment and what the implications are for the future.
Yes, definitely. I think it's great that us here at 3W, that we're able to provide this service not only for women but for men. And I remember in our conversation before, you were saying that you've seen a lot of men come in and they're like, my wife sent me, or, these stories that come up and where they don't think they need to, but actually it's essential as well, for everybody, not just children and women, but also men. And in this regard too, right, to all sexually active men, for them to make sure that they're well and healthy as, in their lives too. So are there any recommendations that you would give to our listeners, especially the male listeners on our podcast today?
Yeah, absolutely. For guys, I just want to take a step back to what we were talking about, like STI testing being provided here at 3W Medical for Women. I know it's a women's clinic, but you guys also see male patients. And if you guys are out there and think, am I going to be the first guy there as a patient? The answer is no. There are many guys that's been through. When I volunteered there, I even asked Dr. Rutherford about some things as well, not only for my own education, but for my own understanding of my health. So I would proudly say I've acted as a patient at 3W, and I've worked with patients that are male patients at 3W. So guys, it's okay if you want to go and learn more about your health, especially if you're concerned about STI infections. It's always a good stop to learn a little bit more, get tested if you need to, and get treated if that's the case. You know what I mean? So I highly recommend it overall. And in terms of the recommendation in general for men's health, I personally recommend my patients, especially the young adults, the young males who are in their 20s to their mid-30s, is to go get an annual checkup, an annual visit with your doctor, and to see where things are at. And if everything's good, I come back every 2 to 3 years. Is what I tell my patients.
Okay.
For those who are over 35, I say 1 to 2 years. Just because as time goes by, things might come up and we want to catch it before it's too late. And with like diabetes and heart disease, there's a lot of like focus on getting screened for those. Because for diabetes, I've looked at different places. Is like, is it more common in men or more for women?
Sure.
There's different places that say it's more for men. Some places say it's more for women. But in reality, my personal opinion is like women go see the doctor more often and we are able to pick it up a little bit more sooner than men. But I think, in the same way, there are different things that predisposes men to diabetes. And the complications from diabetes is a little different too. That like includes, heart disease, kidney disease, sometimes issues with your brain as well. And and one of the things that predisposes men a little bit more towards diabetes is
For more information about
weight
3W,
measurements.
please
It's
visit
kind of
our
a weird
website
way to
at
think about this, but, like,
3wmedical.org.
obesity is
That's the
like
number
the
3,
measurement of BMI.
the letter W,
For men,
medical.org.
Our bodies,
From there,
our
you can
fat
learn more
distribution
information
tends to go
about
to
the
our
services
belly.
we provide.
As
Book an
compared to
appointment
women
or make a
whose
donation if
fat
you'd like to
distributions
support our
go more
mission.
towards the buttocks
You can
or
also
towards the
call our
femoral
office
area,
at
which is like the thigh
206
area.
588
Yeah, there's like a connection
0311.
between
That's
like
206
central obesity,
588
like the fat distribution to the
0311.
belly.
If you like this
There's
episode,
connection that
please
for
share it
men
with others and consider
to
subscribing on your favorite
diabetes.
podcast platform
And
so you never miss an
I've
episode.
looked around and
Thank
the
you so much for
number that
listening,
they've given
and
me
until
is
next
37.
time,
If it's,
stay
if
healthy
your waist
and be well.
circumference is like 37, you want to consider being a provider and talking about better lifestyle modifications and rule out any future complications. So diabetes is a big one. Heart disease, the risk is increased in men compared to women. If you smoke, that kind of increases your risk as well for heart disease. And every time you see a provider is an opportunity for mental health intervention. So those are kind of the 3 things that were, as Men's Week's coming around, is like a primary focus.
Right.
So hopefully I didn't ramble on.
No, I'm sure this is...
I wish patients know.
Yes, no, and I'm sure with your experience as you continue on in your career as a physician's assistant, you'll see more of those highlights. And I so appreciate you connecting with us to share some more education to our male listeners out there. I'm sure they're super appreciative as well. So this is all great information.
I mean, I just want to reiterate, this for you guys who are insured and have insurance, go see your doctor if it hasn't been so for like a couple of years, just to see where things are at. And there's no stigma in going to see a doctor. And even if you have a fever or like a cold or something, or even STI exposures, like an infection exposure, it's fine to go see a doctor. It's better now than late. And, whatever barriers kind of get into your way, there's always means to go around it. So I highly encourage it.
Oh, well, Hiep, thank you so much. And thank you to all our listeners. I hope this episode was encouraging for you and just learning a little bit more about maybe some key points that you can be aware of as you walk through your day-to-day lives. But yes, Hiep, thank you so much, and hope everything's going well for you over there in the Tri-Cities. And we wish you the best. And hopefully you'll be on another episode with us soon.
Yeah, absolutely. Thank you, Alejandra. I look forward to it. And a little shout out to the fathers out there to have a happy Father's Day as well.
Oh, awesome. Thanks for that. All right, Hiep, take care.
You too. Thank you.
For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you liked this episode, please share it with others and consider subscribing on your favorite podcast platform so you'll never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.